Good afternoon, everyone. I'm Janice Whitaker, CGNE Administrator and Community Liaison. It's my pleasure and privilege to serve as host of the CGNE Seminar Series. This program is being provided by the Teresa Neese and Helen Diskovich Center of Geriatric Nursing Excellence at the Ross and Carol Neese College of Nursing, in collaboration with the Office of Outreach and Professional Development, the Center for Nursing Research, and Age-Friendly Care PA. Today's seminar, Opening Minds Through Art, an intergenerational approach to enrich geriatric care in the health professions, will be presented by Dr. Elizabeth Lika Lokon, founder of OMA at Scripps Gerontology Center, and Doctors Danny George and Cheryl Dellasega at Penn State College of Medicine. Before we begin the presentation, we do have some disclosures and announcements to make. Penn State Ross and Carol Neese College of Nursing is approved with distinction as a provider of nursing continual education by the Pennsylvania State Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission and Accreditation. Participants with a valid RN license who attend the entire nursing continuing professional development program can earn 1 contact hour. Partial contact hours are not awarded. The topic of this education is non-clinical, and therefore we did not identify, mitigate, or disclose relevant financial relationships. In order to earn contact hours, Zoom in and out times will be recorded, and the post-event evaluation survey must be completed. Please be aware that this seminar is being recorded. If you have any questions that will be addressed during the Q&A discussion portion of the seminar, please enter them into the chat feature at the bottom of your screen, or you can raise your hand and Jenny will unmute you so that you can speak aloud. We will be placing a link for the post-event evaluation survey into the chat after the presentations are completed and before the discussion session. If you're an RN seeking contact hours, it is required that you complete the evaluation, but we do ask that all attendees complete it to provide us feedback on the seminar. Nurses will receive a certificate within a month of the seminar. If you have any questions at all, you can always reach out to CGNE at psu.edu. Okay, so next I'd like to introduce Susie Gong, one of our CGNE graduate DNP affiliates. Susie is currently working on designing a project to implement depression screenings and non-pharm approaches for older adults with mild to moderate depression. Thank you, Susie, for introducing our speakers today.
Thank you, Janice. Elizabeth Lokon is the founder and director of Opening Minds Through Art, OMA, an intergenerational art program for people with dementia based at Scripps Gerontology Center, Miami University in Ohio. OMA uses art to provide creative self-expression and social engagement opportunities for people living with dementia and skills to connect across generations for students and community volunteers. OMA has been replicated in over 200 communities throughout the USA and Canada. As an artist, gerontologist, and educator, she frequently speaks on the intersection of the arts, dementia, and intergenerational service learning. She has made over 180 presentations of her work in North America, Europe, and Asia, and has published in over 30 peer-reviewed journals and several books and book chapters. Daniel George is Associate Professor in the Department of Humanity and Public Health Science at Penn State College of Medicine. He earned his PhD and master's in medical anthropology from Oxford University in 2010. Dr. George is co-author of The Myth of Alzheimer's, which was published at St. Martin's Press in 2008, and has been translated into 4 languages and co-authored of American Dementia. He has over 140 professional peer-reviewed publications, and his research on intergenerational issues in dementia care has been recognized by the global advocacy group Alzheimer's Disease International. In addition to teaching and research at Penn State, Dr. George has co-founded the Farmers Market in Hershey and a community garden on the hospital campus. He has served as a member of the Alzheimer's Association Regional Board in Central Pennsylvania. Cheryl Dellasega is a nurse and geriatric nurse practitioner. She learned her PhD from Tampa University and a MFA from Roseman College. She currently works as a professor of humanities and gender studies in the Penn State College of Medicine and is a research consultant to Penn State House Nursing. She writes and speaks frequently on female relationship issues and is the founder of Club and Camp Ophelia, organizations which serve a diverse group of girls in grades 1 to 12. Her community outreach is focused on women who are vulnerable due to incarceration, addiction, homeless, domestic violence, and/or mental illness. 2 of her books address relational aggression in the professional area, What to Do When Nurses Hurt Nurse, and Toxic Nursing, which was awarded the AJM Book of the Year award. Now I'm gonna turn to the speaker.
Thank you for the introductions. Let me share my screen and begin the presentation. So everybody could see that okay, right? Let me just go a second here.
Yes, looks great.
Good. Thank you. So the presentation today is going to be about opening minds through art, or shortened to OMA, an intergenerational approach to enrich geriatric care in the health professions. We'll go through quickly through, why do we do intergenerational art programming, and then we'll introduce OMA, and then we'll switch gears to how it enriches students' experiences as they become healthcare professionals, and then specifically about the relevance to nursing students, and then we'll close with how to get involved with OMA before the Q&A. So that's the plan for today. So let's start with just defining what art making is. What is art? So when we think about art, we think about museums and galleries, and people say, oh, I'm not an artist. But we're not talking about art with capital A. We're talking about art with a small a, which is defined by Ann Basting as creating something new that is of value. So it could be as simple as decorating a cake or doing a flower arrangement. All of that is counted as art making. So art with a small a that is more accessible to everyone. What is the rationale for doing intergenerational art making? Intergenerational, by definition, you're putting 2 people from across generations to make art together. So by definition, there is going to be social connection, and social connection improves mental health. We already heard this, especially during the pandemic with the isolation and loneliness. Social connection is a basic human need that is necessary for our mental health. And then when you're creating something new that is of value, you get a sense of accomplishment. Oh, I did that. I can't believe I did that. So whenever you do that, that improves your sense of self and improves your mental health. To do something new, to create flowers or decorate a cake or make a little Christmas card, handmade Christmas card, or write a letter, you're actually using your brain to make those decisions, creative decisions. And anytime you create something new, that you engage in something that you've never done before, in creating something that didn't exist before, you're always developing new dendrites, and that improves your brain health. In terms of physical health, we've seen a lot of studies that whenever you're lonely, you're increasing your risk of death from all causes. Hospitalization, heart disease, dementia, all of these are associated with loneliness. So connecting with another generation and making art reduces loneliness and thereby improving physical health. Social role, especially for people that are cognitively impaired, living in institutionalized setting, in retirement communities, they tend to have that role of a sick person or a dependent care recipient. But when we provide them with opportunities to create art, to engage in the arts, whether it's music or visual arts or theater, dance, movement, whatever, we are giving them an opportunity to develop a new social role as an artist. And if they have a younger person that they're connecting with, because it's an intergenerational program, they have a new role as a teacher. It may not be explicit, they may not realize it, but they are teaching the students on how to actively listen, how to be caring, how to be empathetic, and how to communicate with another human being as a human being. So thereby, they are, in fact, teaching the students, because the students cannot learn all these soft skills, all these interpersonal sensitivity and attentiveness without this direct interaction with the older adults. You know, you can't teach them that in the classroom on campus. So in fact, they are having a new social role as a teacher. So opening minds through art is developed initially for people living with dementia. And later on at the end of this session, I'm going to share with you how we have evolved since the pandemic, where we are actually working with people without dementia as well. But originally, it's developed for people living with dementia. And OMA means grandmother in Dutch and in German, and I'm Indonesian, so I call Indonesia was a colony of the Netherlands for 350 years, so I call my grandma OMA. And I have 16 grandchildren, and they call me OMA. So we started with OMA, and then we found the words opening minds through art. It was developed in 2007 as part of my thesis here at Miami University. Basically, I combined my undergraduate degrees in fine art with master's in gerontology and PhD in education to design the program. So in the last 15 years, we've been teaching people all around, especially in the US and Canada, to implement the program. And we have now it's been implemented in over 200 communities throughout North America, including at Penn State. We have several people there locally that went through the training. And they're doing OMA in their memory care program. So I'm glad to hear about that. But at Miami University here in Ohio, there are over 2,600 students that went through the program. We have published studies that we'll share with you just a little bit, very briefly later on, how it benefits both the students and older adults. But I think in this presentation, we're just going to share the effect, the research impact on the students, because we are so limited in time. There are all kinds of different awards for best practices, but the most exciting award that I look forward to is that I get to go to Indonesia on Fulbright in February next year to bring OMA to Indonesia. The mission of the program is to build bridges across age and cognitive barriers through art. So art is the tool, but the substance is the bridge, the relationship between the younger and the older person. And the older person is living with dementia. So that's the original mission when we developed this program. It came about as I didn't know anything about aging. That wasn't my background. And so as a student, I would start visiting nursing homes, and these are the kind of arts and craft projects that I see. It's inspired typically by preschool, and you have 12 people, they create 12 the same things, turkey hands or pumpkins, or, and it's really not emphasizing their strength. It's partly lack of education on the activities profession as a whole, and lack of funding also. So it's not really the activity director's fault. It's just the whole system seems to be working on a shoestring. So with OMA, we look at modern art, because modern art is accessible to anyone, right? You can have dementia, you can have advanced dementia, and you still can create beautiful art. So these are some examples of art work created by older adults in the Opening Minds to Art program. And they came to us with no art background, but we give them materials, we give them processes, they follow through, they make decisions along the way, and they create beautiful things. And when you have 12 people doing it, the same supplies, the same processes, you get 12 completely different things, because each one is created with decisions, aesthetic decision made along the way by the people involved, by the artist. So just to give you a flavor of what it looks like, this is a 4-minute video that shows you OMA in action. People with intact cognition oftentimes try to free ourselves from the limitation of having to draw this thing that looks like that, And when you are free from that, you can then break into the abstract world more directly. So when the ability to express is impaired, they think the content is gone. And that's where the violation of human rights come in, because the human is still there. It's just that they are locked behind the disease. It doesn't mean that there isn't somebody in there that's trying to express. And so art is a sort of channel. When logical thinking and verbal expression is impaired, art is still there for them to express.
And when I see what I do, and I realize how it comes out, I'm beside myself. It really is.
Working with people with dementia and learning more about it, not just via textbook and what you see in movies, how it's portrayed, I guess. It's changed my experience at Miami, because now it's everything that I do here. So I don't really know what I would have done without this program. I think that being involved with this has given me purpose on this campus. I work and I have friends and I feel like I'm doing stuff, but gerontology has made me feel like what I'm doing is really going to make a difference, especially at Miami, because I can be a part of the gerontology club that raises money, and I can help the residents in the community, and it furthers my, I don't know, drive to do that throughout my entire life.
Put an ocean and a river between everything yourself and home. You must be somewhere in London. You must be loving your life and the wind. You must be somewhere.
Too often people with dementia in long-term care facilities, everything's decided for them, and they don't make decisions, and it takes too long, it's too confusing, and this is the 1 hour where they get to decide everything on their own. So choices are built in, opportunities for autonomy is built into the process, and then success is almost guaranteed.
There's no other experience possible, I think, that brings together two very different generations where they both benefit from an interaction with each other. And it goes back to our core values of love and honor and how we interact with others.
You see the very authentic relationship that they have formed, and just how incredibly proud the artists are of the work that they have produced. You see them leave in a completely different mindset than they entered that room.
It's our obligation to provide as rich and a full experience for these individuals who are suffering with dementia as humanly possible.
The mission of the program is building bridges across age and cognitive barriers. So that bridge is actually a relationship, and within that relationship, at the foundation is love.
So that's what the program looks like in a nutshell. And now we're switching gears to the research and how it enriches students' geriatric experience. To discuss this, I'm just going to lay out the theoretical foundation of what we are what we're evaluating. So here is an image of what we're talking about, that what we test. We're giving students a pre-test and post-test, and then we compare their change over a semester period, because they do this allophilia. Allophilia means allo means the other, philia is liking. So we're asking students to complete the survey before they start the semester of OMA, and then again at the end of the semester of OMA, and then we compare and see how they change over time. But allophilia is not the same as reducing prejudice, because reducing prejudice is basically reducing negative intergroup attitudes, but allophilia is measuring positive intergroup attitudes. So intergroup meaning students' attitudes towards older adults living with dementia. So the older adult living with dementia is the other. The interesting thing about this is a work by Patinsky, that a low prejudice score does not predict a high allophilia score. The two concepts are unrelated. Someone could be very not prejudiced towards an out group, but at the same time don't necessarily like the out group. So we're looking at how well do they like the older adults living with dementia, they meaning the students. So these are the kind of questions that we ask in this research. There are three different areas: affection, comfort and kinship, and engagement and enthusiasm. And you can see some example questions like, I respect individuals with dementia. I feel positively towards individuals with dementia. I'm at ease around individuals with dementia. I feel like I can be myself around them. I'm interested in understanding their point of view. I'm motivated to get to know them better. So all of these questions is measuring how much they really like the people they work with, in the case of nurses and doctors, if the patients are living with dementia. So this first study is undergraduate students at Miami University, and you can see there the green is the flat line here are about 500 non-OMA students, intro gerontology, intro sociology students. They take pre and post, and you see that there's no change in their score. But the 200 some students who went through OMA service learning, OMA once a week for a semester, they are statistically improved in their attitudes towards people living with dementia in all areas. You can see the blue line is always increasing at the end of the semester. So now Dr. George is going to take us through his experience with medical students.
Yeah, thank you, Lika, for that beautiful introduction. So yeah, a lot of my work here in our College of Medicine has dealt with how to integrate the arts into assisted living, skilled care nursing settings and involve medical students in that work in a mutually beneficial way with residents. And I often kind of jokingly call these approaches social pseuticals, as opposed to the very limited efficacy of pharmaceuticals that we have in geriatric care. So OMA is a example par excellence of a social pseutical that's really, really beautiful to participate in and observe. And so we wanted to build on Lika's initial research a few years ago with undergrads by looking at how medical students would be affected in terms of their attitudes toward people living with dementia. And so we basically pulled together 6 medical schools in the United States and had 52 students participate in a year-long program in 2019, 2020, right before the pandemic. And they all participated in OMA for that stretch. Their participation ranged from 90 minutes overall to over 800 minutes overall. So the students at Penn State here went once a month for 2 hours. It varied at the different sites. You can advance the slide, Lika. And this is one of my students, Valerie, who's working with a student with a resident at Country Meadows. And you can see here they're at work on one of the paintings that Lika showed before. And these are some of the ones that came out of the sessions on the right. And so at Penn State, we had about 20 students participate. And again, they did monthly visits to the Country Meadows facility. Lika, you can advance it. And just as Lika had done before, we did pre-post testing on a variety of validated instruments, the dementia attitude scale, the allophilia scales, and we found sort of across the board, with the exception of one scale, the UCLA instrument, we found statistically significant improvements in student comfort, knowledge, allophilia towards people living with dementia. So it was a pretty dramatic finding. We had a small control group that we measured our student participants against. So it was we published our results in the Journal of the American Geriatric Society. That's listed in the materials that I think everybody received today, if folks want to dive deeper into this study. But we sort of have built on the undergrad efficacy of OMA and shown that students in the health professions, including nursing students, potentially can benefit in their own attitude and professional role development from participation in this work. Next slide, Lika. And as part of this initiative, we also collected qualitative data. We had students write reflective essays, and I'm going to invite our colleague Cheryl Dellasega to speak to this component of the research.
I need to take myself off mute so people can hear me address this part of the research. So the question was, we saw the statistical improvement in the different dimensions of the quantitative measures, but the question remained, like, what about OMA makes it so effective? And we could only really figure that out with a qualitative analysis of the narratives these participants created at the end of their experience. And they were just asked to identify how OMA impacted them. And then Danny and I did a qualitative content analysis of all of these narratives, looking at what students had to say. And these were all medical students. So they described really 2 main outcomes that we thought were significant, but there were several other themes. Basically, this idea of having the preparatory session, which is very pragmatic, very focused on what people living with dementia experience, what resources remain, how to communicate, so on and so forth. And then as well, the creative activities, those standardized programs that the students were doing with the persons living with dementia each time they went to the Country Meadows site. Other significant themes were really these connections with inter and intrapersonal aspects, the mastery of anticipated challenges. Many of the students were a little bit nervous and anxious about going to work with an older person, but they developed mastery and discovered that they indeed were able to be very effective in their interactions. acquiring new knowledge and skills. Like it was a big revelation for many of the students that the emotional component of the person's personality remains during dementia, even if other aspects are lost. I remember that was commented on quite a bit. And then appreciation of healthcare team members. So they got to have different relationships with the nursing home staff than they would normally if they were coming in kind of a medical role. So teaching healthcare professionals of all kinds, I think, to have these resources and embrace clinical work with people living with dementia who are often seen as kind of difficult. It's often overlooked. And this study suggests that if you put together the kind of specific contribution of the medical knowledge and the artistic expression, it can kind of address this gap and benefit both the students and the patients that they care for. Next slide. So here are some of the quotes, and I'm not going to go through and read all of them to you, but you can see that these two capture this idea of helping people to express themselves. One specific experience allowed the person to learn about this individual's life and their experience with memory loss. It was really eye-opening to see how their own grandparents might have experienced aging, and kind of growing up and assisting elderly patients navigating simple tasks became a really healing and insightful thing for people, just even like holding a paintbrush. So it was very humbling and rewarding, and it really gave the students a feeling of giving back. And I would note that our medical students don't get a lot of concentrated geriatric experience. So this was a really good opportunity for them. Also, just developing a real, I think a lot of times, I know with nursing students and medical students, there's kind of this fear or this inability to connect with older people in general, this kind of suspicion or worry or anxiety. But I think that putting them in this situation where the art was kind of the focus really allowed them to see the opportunity to express and process emotions, and how that could be motivated or operationalized through these art lessons. So even fourth-year medical students going into psychiatry, still will have an interest in geriatric psychiatry, which if you're in nursing, you know how rare those folks are. Next slide. So as a former nursing faculty and now as a medical student faculty, I see a lot of nursing implications to OMA. And I go back to I think, early on in my practice as a faculty at Penn State, I think it was, I did a study, and older adults were the second least preferred group that nursing students wanted to care for. The least preferred at that time was HIV patients. So I think that it would be interesting to look at students who did OMA and see if this shifted at all, if they had more interest and willingness to pursue a career in geriatric nursing. Exposing them to the creative capacity that remains in people with dementia can really change how you look at geriatric care. And I think I would argue there's even a cost benefit to it, because there's an enhanced capacity that occurs when you put people in these situations. I think that it would be a great opportunity to put it in the preclinical or early clinical years for nursing students, because one of the things we saw with medical students is that it enhanced communication. And a lot of times, we think students, they're caring, they want to be great practitioners, but they've never really talked to a patient before. And so they can be nervous about that. The patients can be nervous about that. I think OMA, again, is a very relaxing, enjoyable experience that teaches communication skills that students wouldn't learn in other courses that are specific to older individuals. So this non-procedure, it wasn't anything medical, it wasn't anything oriented towards healthcare. It can really give you the other aspect of a person, an older person's life and their abilities. And finally, this idea that you can come together where there's not, I'm the doctor, I'm the nurse, but we're all this team of people who are trying to enhance the lives of persons living with dementia. It puts it on a level playing ground and kind of offers opportunities for different kinds of interactions. Next, I think that's the end of mine. Yeah.
I'm going to go to the next topic, which is how to get involved with OMA. There are 3 different ways Thank you, Cheryl, by the way, and Danny for your parts of the presentation. There are 3 different ways to get involved with OMA. If you really want to take OMA to your location, wherever you are, you can be trained as a certified facilitator. Or if you want to infuse the arts into your caregiving practice in whatever role you are in, there is a creative caregiving guide that is available and free right now. And then in the early 2023, in January, February next year, there's going to be a Scripps Avid that we develop, and I will tell you more about that. So for OMA facilitator training, there are 3 people at Penn State that already have gone through this training. You can do it either fully online or hybrid. And basically you get all the tools and all the videos and art projects, everything to bring OMA to your community in whatever role. It doesn't have to be a nursing home staff. Typically that's our trainees are nursing home staff, but in the case of Penn State, you have faculty member and staff that are trained to bring OMA to Penn State. And then I don't know if you are all local from Pennsylvania, but if you're in Ohio or Virginia, there is grant funding to implement the program. So you get financial support to do that. So that's like the deepest training that you can get to bring OMA to your own communities. And you can see the link down on the bottom here, caregiving.scripsoma.org. And here you'll see 19 lessons divided into these 4 portals. So visual art, music, dance, and poetry. And these lessons are created by master teaching artists that were picked from leading programs in the country by the National Center for Creative Aging. And we came together in several retreats. We filmed this. Basically, these are short videos that you could, 10, 12 minutes, that you could learn how to infuse the arts into your care practice, whether you're a caregiver at home working with your own mom, or whether you're a staff person working with a client in an adult day center or in a nursing home, or an artist who wants to start working with older adults. This is a great resource. It's free, it's available, and you can just watch these videos and then learn from the videos. In each video, you have 3 people, a person living with dementia. None of this is role played. So a real person living with dementia, their caregiver, care partner, and a master teaching artist. And then the master teaching artist is showing the care partner how to do these arts with someone living with dementia. So you can see all that in action in this resource. And the third resource here is mostly for people without dementia or people with early stage dementia, because it's technologically based. So this came out from the pandemic years. We had to switch our in-person programming to virtual programming. And so we had, I didn't think we could do service learning online and achieve the same kind of allophilia effects that we get from the in-person exchanges between the younger and the older. So I was very nervous at the beginning, but we tried and we tweaked and all that. And it turned out it was very well received by the older adults who are not living with dementia, most of them, or very early stages of dementia, and the students. And we did the same study of allophilia pre-post, dementia attitude scale pre-post, and then we compared with the students who went through the in-person OMA. And to our surprise, the change in the pre-post is the same, whether they go through online or they go in person. And that gave us the confidence and the desire to bring this to more people. So that's when we decided to develop Scripps Avid. And Scripps Avid, stands for arts-based, virtual, intergenerational, and dementia-friendly. It's dementia-friendly because it's designed so that when you log in, you create an account, you log in, and you say when you're available, and then we match the younger and the older based on the same availability. And then they just stay on one screen. They go up and down on that screen, and they see their partner on the other side. So all the art is on paper or sharing through talking. There's nothing on the screen. So this is very low tech art making, but done through online engagement. So then they choose from down here whether they want to do just conversation, or they want to do music or visual arts. They choose an activity, they talk together, they see the same thing, and then they say, okay, let's do this kitchen utensils. So then, okay, then we let's go find a spoon and a knife. We're gonna trace it and we're gonna color it. Along the way, they are talking to each other while they're making this. And then while they're making that, there is some degree of self-disclosure, getting to know each other, but every lesson has questions, what we call connection questions, that take people out of the activity into the lives of each other. So in this case, after you do all the tracing and sharing and talking, the questions there is, what kind of food do you like? Where do you learn to cook? Who cooks with you? Who cooks for you? What's your favorite recipes? What's some holiday traditions that you have in your family? So there's all kinds of talking that gets to know and gets the two sides closer to each other through the art making, and then leaving the art making into connection questions that let people to disclose themselves and build that relationships. And we found that if you just start with these questions directly without the art making first, it feels too awkward, and people are not willing to be vulnerable. But if you go through obliquely through the arts first, art making and talking and chatting, and then things would flow more naturally into the connection questions that let the two sides build connections. So that's what we're going to have next year, and we're looking for users, both older adults and younger adults, anybody age high school and higher. And the model we're going to do here at Miami is we're going to connect the current Miami students with alumni who graduated in the 1960s or 70s. So we have intergenerational bond across the same alma mater. So if Penn State would like to do that, we'd like to invite you to use it, because this is all free, and it's about connecting generations and also addressing loneliness that we all experience. These are our contact information. Scripps OMA and Daniel George and Cheryl Dellasega. So contact us. We're on Facebook, Instagram, and I think this brings us to the end.
Okay, well, thank you so much, Lika, for sharing the evolution of this incredible program. And it was interesting to hear about the acronym OMA and how that by itself evolved. But I know it's just such an incredible, dynamic, engaging program. So thank you for sharing all of that. Danny, it was great to hear how you're implementing this with medical students and the outcomes and the evidence through research that you've identified. And Cheryl, thank you for sharing your insights about how this, could be used with nursing students in particular. So thank you for all of that amazing information. Jenny we're going to take a pause. Jenny will be putting the link to the evaluation tool in the chat. I'm going to just take 1 minute of, quietness to allow people to copy and paste the link and begin the evaluation tool if they choose to now. But I want to make sure we come back for some Q&A and discussion in just a minute. That may not have been a full minute, but I want to make sure we have time for discussion about this amazing program. As I've shared with Lika, Cheryl, and Danny, and some of our audience already knows, we had the opportunity here at the Ross and Carol Neese College of Nursing to implement OMA this fall as part of our Living with Dementia community education program. Initially, we wanted to do a memory cafe to provide some respite for the care partners to be able to attend the educational session and have their loved one with dementia be in the memory cafe so that they could, be in a safe, supportive environment. But I think it was Dr. Diane Barish and Dr. Anju Paudel who recommended we should look at OMA, implementing OMA as part of the programming for the Memory Cafe. And it became way more exciting and meaningful than we ever imagined. And Jenny Rank, Megan McGraw, and Diane Barish were trained as OMA facilitators and led a cohort of volunteers, many of them being our undergraduate students. And we thank Sierra Funk and Pauline Huang for their involvement in the program, as well as the many volunteers that we had that were graduate students and faculty. But to your point of some of the outcomes, the intergenerational aspect was incredibly valuable. We were hoping for it to be a positive experience for the undergraduate students interacting with people with dementia. The creativity and the impact on the brain was amazing. And I hadn't really thought about the physical health aspect of it in relation to social connectedness and decrease in loneliness. So thank you for sharing those concepts with us today. I just want to share one quote from the evaluation from Living with Dementia that was a care partner's perception of her husband's experience with OMA. She said it was a great experience. Each evening after the Memory Cafe, he was much more interactive and expressive than usual. And that just, was very powerful to me. But I want to invite others to share comments to our speakers as well as ask questions. So we'll open it up to other folks as well. Go ahead. Go ahead, Jenny.
I was just going to ask a quick question about, because I know OMA's original kind of inception was within long-term care communities, and with its growth, even with our own implementation, we did a little bit more of a community-based implementation of OMA. Have you looked into kind of the differences between the traditional implementation of OMA and more of a community-based in terms of outcomes or anything like that?
We have not done that study, but OMA has been adopted by several different communities throughout the country that is funded by ACL funding. And so they send their staff members to go through the training and then offer it in adult day centers. And we also offer in one adult day center here locally for people that are living in their own homes, not in the nursing home. So the nursing home is more of a convenience because they're all there, but it doesn't mean that it's limited only to people living in nursing homes. It's just made accessible to anyone who's living with dementia. But if you need some kind of team building activity within your own department with other nurses or something, you can do an OMA project, and you can see that everybody will delight in it just the same, whether or not they have dementia. But no, we haven't done a study on the difference.
And I was fascinated by, the need to shift, of course, to a virtual OMA program during the pandemic and the results. Can you share a little bit more about how those results were similar and if there were any differences to the in-person OMA program?
So we're writing a paper right now about that. And basically we gave the students who are in online program the same scales that we gave to the in-person OMA students in order to see whether we are achieving the same learning outcome or not. And when we compared the data, the magnitude of change is the same, whether they're online or they are in person, and it's statistically significant. The raw number is slightly less, but in terms of large, moderate changes is in the same category. And the biggest change is in comfort and kinship. And that's the same with the in-person students as well. They just feel a lot more comfortable and more connected, more related to people that they work with. It increases in affection and engagement and enthusiasm also, but the biggest increase is in comfort.
And as Cheryl was talking about earlier, you know, that just the idea of potential recruitment into geriatric nursing or other healthcare professions that, you know, interface with older adults and raising their comfort level and with interactions is just incredible. Diane Barish is asking, any suggestions for student volunteer recruitment? The version we implemented at the College of Nursing was part of a class that was required. And, you know, we're hoping to continue OMA moving forward. But we're wondering, you know, if it's voluntary, what type of responses have you had?
So I could speak to that a little bit, and then Lika, I should hand back off to you as the expert, but so we implemented this program obviously 3 years ago before the pandemic. Some of the students who were first years then are now fourth years and have resumed doing it as volunteers. And there's a student interest group that has formed with first and second year students also participating. And they go over every Monday afternoon to Country Meadows from 3 to 5 and are doing OMA again, totally on their own volition. You know, I show up and help them when I can. The staff at Country Meadows is very enthusiastic and helps set up the projects for them. So it's a totally self-running program for the most part. And I'll just share one success story. Janice, kind of building on what you were just saying. One of the students who was a first year all those years ago, pre-pandemic, is now going into geriatric psychiatry in part because of the OMA experience. And these things really do affect professional development for students and give students a sense of purpose, a different way of seeing people living with dementia. And it can be really powerful and lasting. So it's great to see those metamorphoses in students. And I would expect the same would be true for nursing students as well.
Oh, well, thank you for sharing all of that. I think we have a person that wants to be unmuted. Thank you, Jenny. So this is Dr. Pauline Huang, who is faculty at the Hershey campus that helped us integrate OMA in the Hershey area.
Hi, can you hear me?
Yes,
Okay.
we can.
Okay, so this Zoom is a little, different than the Zoom that I had, but anyhow, I can see my face, so I don't know whether you guys can see me or not. But so I have a question. I'm very interested in this implementing this art into the patient with cognitive impairment. So have you done any research on patient with cognitive impairment? Of course, patient living with the dementia, but do you have any outcomes of the, MoCA or, MMSE, changes the improvement of their memory and cognition with this after this implementation?
We have a couple of studies that look into the well-being and also on the older adults' own evaluation, if they could respond. We collect those data, and then we ask them whether their time was well spent and whether they enjoy their time. So we have that kind of evaluation data, and we have observational data, both video analysis of facial expressions and also just observation of well-being that we record every 5 minutes. We record emotional expressions and degree and intensity of those expressions. So those studies are in our website, which is scriptsoma.org. But we have, in terms of effect on memory, we have not studied that per se, but we have anecdotes where a caregiver or a staff person would say they don't know anything like what they had for lunch or anything, but they know when it's an OMA day, and they know when a daughter calls and, you know, how was your day? Usually they don't get much. And then, but if it's an OMA day, they get more stories, you know, so you get that kind of anecdotal, but we have not, I don't believe that OMA can improve your MOCA or MMSE scores. I think it's just not that robust, and it's not, it won't be measurable if we try to measure it.
Okay. Actually, I had to watch this YouTube about this art implementation in Japan. So a lot of patients with dementia, they implemented this art. It's a little different than this art, OMA, but actually they have the data, showing that it's improving their cognition. So I was very interested in that after watching that one. But this OMA, I had a good experience during this semester actually with my students. I can see my students, they really liked, especially few students really liked this art project with the older population. So I am actually looking forward to implement this OMA to my personal research, and also my student for the future. Thank you.
Thank you, Pauline. Allison is commenting, would OMA, or questioning, would OMA be something that could be integrated as part of a Gero clinical, perhaps in a long-term care setting with residents? Cheryl, do you want to?
Is that a nurse? Is that a nursing?
Yes, I
clinical?
believe. Yeah.
Having done nursing clinicals,
yeah,
many nursing clinicals, and especially with dementia units, I think OMA would be excellent, because you would get both the pragmatic education about dementia ahead of time, and then all of these opportunities to interact with older adults. And it would also foster a more positive view of capacity, I think, in the later years. You'd obviously have to go through all the steps of the training and so on, and getting buy-in. I know Foxdale is up there, and they seem like the perfect place to do a project like this. But yeah, I would think it would be great for nursing students to do this, and even pre-nursing students, like those headed for nursing, that want to explore further and maybe plant the seeds early on that it's really great to work in geriatric.
Right. Yeah. And I love that idea that you mentioned as, getting this into the nursing curriculum earlier in their experience, so that they do have those positive experiences to build from. So we have a question about how long the OMA training is. Can you talk about that a little bit?
To do the facilitator training and actually run the program in your own community is about 20 hours, but to volunteer in the OMA program as a student, or even yourself as a volunteer, is about 2 hours.
Yeah, so in our case, the students did have some pre-learning, before they had the Memory Cafe, the OMA experience with the Living with Dementia programming. I just want to, Kimberly Van Heitzma says, your work examining mechanisms of action and a focus on positive outcomes for all involved is very exciting. Thank you for your wonderful presentation. And there's a couple of other comments in the chat as well. Sarah Songer, one of our nursing alum, is wondering about approaching HHD biobehavioral health students. She's suggesting this because she has a granddaughter in that program, and she's somewhat familiar with the program objectives and thinks it's going to align with that nicely.
We do
And-
have one more hand raised, but I'm not
Okay.
sure if we have enough time.
We're actually at 1 o'clock. So I'm afraid we do have to actually end. Thank you, Jenny. But, on behalf of, myself, our leadership team, our, Ross and Carol Neese College of Nursing, we want to thank you so much, Lika, for developing this program, for sharing it with us today. And Danny and Cheryl, thank you so much for your contributions as well. It was really great to hear how this engaging, creative art program can be used with various health professions. So thank you so much.